I've interviewed people on my podcast who have narcissism, who are, I'm not saying that right, who are narcissistic, who
are narcissistic. That's a good way to put it.
Okay.
Yeah, because we don't diagnose. I don't get into any of the diagnosing of anybody ever, because that's just not where it lies. But a lot of us have narcissistic traits. So let's kind of dive into that. Narcissistic traits show up in all of us. The point being is, can we self-reflect and take a peek at ourselves and kind of learn and grow? Or are we in a fixed mentality that can't grow? So, so tell me a little bit about your story, just to kind of get us started.
Sure. Yeah. I kind of suffered through some addiction since I was in high school. And later in my 20s and 30s, I was having lots of anxiety and depression issues on top of the addiction ish. I don't know if I had an addiction then, but let's just say I liked alcohol and weed. And then, eventually it turned into a suicide attempt and, constant suicidal thoughts. And eventually I did have to spend some time in a psych ward, and then eventually a treatment center. So once I got sober, it was kind of like, that's when I was able to, I don't know, I had a strong enough base to then keep moving forward with my proactive, I don't know, healthiness, I guess.
Good.
So, yeah, I mean, it's been a long journey. And then about 2 years ago, I was diagnosed with ADHD, which put even more things into perspective. And and during COVID, I started the podcast and stuff. And I've learned probably more doing the podcast than I maybe could in a university class. I say that because I've never been to a university class.
Yeah. Okay, fair enough. But I do understand that. Like, I have learned so much through podcasting and the research that you put into everything and the people that I get to talk to. So, So do you think that the addictions or the addictive behaviors, were they coping skills for trying to just cope with life or stress, that kind of thing?
Yeah. The more I've learned about ADHD and neurodivergent people, like being undiagnosed for so long, because I was 45 years old once I was diagnosed, that things like addiction can, or I mean, a lot of people undiagnosed do suffer with addiction. And when I was in addiction, like now I can, look back, and I've talked to people who, like I said, are narcissistic. And I related with a lot of what they were saying in a way, because I feel like substance abuse disorder could almost be a cluster B personality disorder too, because there's so much overlap. And I mean, all the cluster B's there's a lot of overlap with traits and personalities and stuff, but and they're all treatable too. So, I mean, with addiction, I was treated, and, I can also relapse at any point. So I often wonder if people with maybe are diagnosed narcissistic, or maybe spouses or people in their life claim they are with someone who's narcissistic, but they're actually with someone who's just suffering with addiction or maybe undiagnosed ADHD or something. And yeah, they're just really bad coping skills, and it comes out looking like narcissism.
Narcissistic. Yeah, that's a great question. And one that I do get asked often in my, my Facebook group that I run. It is a conversation that does come up quite a bit. And I totally get what people are saying with, how do I know this is narcissism and not alcoholism? Or how do I know this is, narcissism and not somebody on the spectrum? These kind of questions do get presented a lot. And so I want to explore that with you a little bit, because you've lived down this path, and I have not. I cannot relate to that, but so I love the conversation.
You're perfect.
But yeah, no, yes, of course, no. But with all of us having narcissistic traits, like I've said so many times,
Uh-huh.
the difference is what I've always said is somebody who is narcissistic, they can't self-reflect and they can't see it in themselves. So you might have somebody who's narcissistic and alcoholic. Okay, you
Right.
might have an overlap there, but when the alcoholism gets treated, okay, when they get some better coping skills and they get kind of past that. I mean, I once an alcoholic, always an alcoholic, but there are better ways of coping with that, and people, work through that. Okay, great. But does that then cause the narcissistic traits to go away?
Yeah.
And
Gotcha.
that's a question that often comes up because a narcissistic person is they have these coping skills that are put up in place because they cannot handle the vulnerability of life. Okay. And so they have coping skills put in place. Now, those coping skills are your addictions. That's going to be whether it's an alcohol addiction, a sex addiction, it could be a work addiction, it could be a church addiction, it could be a relationship. The relationships are very addictive, and when you're dealing with a narcissistic person. But the addictions are not the problem, they're a side effect. They escalate the problem. There's no doubt about that. But they're a side effect of somebody that has the narcissistic approach to life.
Uh,
And so there is a separation there. Just because somebody is alcoholic does not mean they're narcissistic. And
right.
just because somebody is narcissistic does not mean they're an alcoholic.
Right. So, I guess it would be hard to tell if someone is narcissistic until they treat their addictions. And then if they're still having those traits, then you're like, oh, okay.
Then, I mean, that's one way to look at it, yes, because I would be curious to find out from you. You said that you were seeing narcissistic behaviors in yourself when you're kind of reflecting back, and now that you're in the situation where you have, treated the alcoholism or the addictions that you were facing, and then let's even separate here in a little bit the ADHD piece that you bring up because that's another interesting aspect to all of this. Um, in that process of growth, then I would assume that comes from getting the help that you needed. Do you still see the narcissistic traits, or do you still see them to the extent that they were? Are you better able to reflect on them and be vulnerable?
Yeah, I'm better able to reflect. Well, I'm just much more self-aware in general. Um, I'm much more, um, regulated, like emotionally regulated, and much more apt to like get feedback or have someone say, "Hey, I think maybe you should be doing this. I don't think what you're doing is so healthy." And then I go, "Oh, right, right. What have I changed in my routine that's not working?" Um, so yeah, I don't feel like I never thought I was maybe narcissistic, but looking back, it's like I could see how people could confuse me back then of maybe having narcissism, but
So some of the traits you saw would potentially have lined up. And
right,
that's where
right,
I'm saying the difference is that
right,
while the traits may be there, we all have narcissistic traits.
mhm,
It doesn't
mhm.
mean we all have narcissism.
Right, right,
Yeah.
yeah, yeah. Because I mean, I was manipulative. I was all types of things. I was, you know, uh, fight, flight, freeze mode all the time, and I
Mhm.
didn't care who was hurt when I was doing it. And of course, usually it's the people I love the most that kind of get the brunt of it. So, um, and doing the 12 steps and stuff helped me realize all that stuff. And yeah, so no, I mean, I knew I was a decent person. I just was not being a decent person during
Well,
that
it
time.
sounds like that and this is not unusual. This is where we say there is this thing called adaptive narcissism, where narcissistic traits do show up, but it's our coping skills while we're trying to figure out who we are. Okay. So
Mhm.
when does this show up? It often shows up in the teenage years. It often shows up in the young adult years. Okay. And
Mm.
a lot of people, you're going to see some form of narcissism development between the ages of 18 and let's say like 28. Okay. Somewhere in that range. Because again, we're living in a world where we don't feel safe. We don't feel like we can handle life. Adulting is scary. Okay. We're jumping into this world where now we've got to be responsible for life and we don't have good coping skills. A lot of us come from backgrounds where we weren't taught how to handle the stress of life. We weren't taught how to emotionally regulate. We weren't taught that it's okay to be less than perfect. Okay, we weren't taught these things. So we dive into life trying to be perfect, trying to make sure that everybody likes us, or make sure that we've got the best job, or make sure that whatever, that we're laying out the picture perfect life. But we can't do that. I mean, that's not possible. And so instead, we put coping skills in place. And those coping skills present a lot of times as narcissism. They're the hypersensitivity, the defensiveness, the passing the blame. But that's not my fault. You know, that was their fault. And so we have these coping mechanisms that come into place. And that doesn't mean we don't care. It doesn't mean we don't have compassion. It doesn't mean we don't have empathy. But the higher level of interacting with people, those develop once we start to drop the narcissistic traits. And then we can develop and expand and grow and learn in our compassion and empathy for those around us.
Right, right. Yeah. Now that you're saying that, even before I think addiction was an issue, I mean, I look back, I've been with my wife since we've been together 26 years or something. And I think back to our earlier relationship when you're just trying to figure out, let alone yourself, you're trying to figure out this relationship. And I'm sure even then I was, both of us were probably having these narcissistic things when in reality we were just growing up, really. I mean, you think of growing up as a kid, but like really,
No,
you
these are
grow.
growing pains. These are real
Yeah,
growing pains.
yeah, exactly, yeah, and it's no wonder that no wonder there's so many like divorces and stuff in their 20s and early 30s, and because some people just don't grow up while
Right.
the other spouse does, and I'm
Right.
very lucky that my wife stuck it all out and we grew up together basically. I mean, it came
That's awesome.
close. It came
Okay.
close, but
Yeah.
and also like in my family, especially with men, there's a lot of anger issues, and I mean, I guess that's emotional dysregulation as
It
well,
is.
and it's also well, I saw a meme a while ago that said anger is anxiety's bodyguard, and that's exactly what I think of when I think of the men in my family. It's like that comes out as anger. And not necessarily at another person. Sometimes it's just you're working on something that this goddamn thing won't fit in the hole. And next thing you know, you're smashing stuff and throwing hammers, and it's scary. And I don't know if that's a part of narcissism, is emotional
Well,
dysregulation.
it's emotional dysregulation, absolutely. And the way it comes out as narcissism then is the person in the room who is now feeling unsafe because of this angry reaction. When this person then tries to reestablish safety, the other person, the one who's thrown the hammer, if they can own it and say, look, I just got mad about the hammer, all is good, and they can reestablish this sense of safety, that's one thing. Okay, that is not a narcissistic defensiveness. But if the person in the room, be it a spouse or a child of this person, if they speak up and say, hey, I didn't feel safe with that environment. It really bothered me that you got so angry. If the response is, well, I didn't get that angry, or, well, you need to learn to get over it. And it's passing the blame, or it's defending themselves, or it's gaslighting. Okay. Heaven forbid. I didn't throw a hammer. What are you talking about? It's
Or
those kind of,
minimizing.
do what?
Or minimizing.
Yes,
Yeah.
minimizing it. That wasn't that big of a
Yeah.
deal. It's just a hammer. You should see what my dad used to throw.
Right.
Any of those types of responses, that's the narcissism that's coming out. So it's not about, emotional dysregulation, yes, but emotional dysregulation, you can be emotionally dysregulated and still not be narcissistic.
Right.
You can still be working on learning how to handle anger, how to put in coping skills. All of this still doesn't mean you're a narcissist. The narcissism comes out when you defend it, minimize it, invalidate it, blame it on something else when you can't own it.
Mm-hmm. So taking absolutely no, not credit. Oh my!
No responsibility.
Yeah. There's a word I'm thinking of. I can
Accountability.
never. That's the word.
That's the word
Accountability.
you're looking for.
I can
Yeah.
never remember that word for some reason.
Yeah.
And and I mean, going through everything I've gone through through addiction treatment and everything, life is like so much easier to live than trying to constantly defend myself and do all those things that just perpetuate. It's like being humble is actually way easier than not.
I agree with that. It's really not that hard to be nice and humble and not perfect.
Yeah, I mean, it's hard to transform yourself from not being humble to being more humble. But once you are humble, it is like, okay, why was I resisting this for so long? This is
I love to hear you say that. Yeah, no, I love that you say that. And so what happens then in that growth that you just voiced, the coping skills of the addictions, you don't need them anymore.
Right. Yeah.
And so the addictions kind of fall by the wayside because they're not necessary anymore.
Right. Yeah, they're no longer serving the purpose that, for whatever reason, they were there for.
Because you were going through life with your guard up. It's like we're walking through life with our hands up all the time, going, I got to defend myself against this and that person, and what do they think, and that person said that about me, and all of this. Everything is related to me. We think that the world is thinking about us far more than they actually are. Okay.
Yeah.
But that's that growth, that period of time where we're trying to go from childhood into adulthood. And as we get into adulthood, if we have a growth mindset, okay, not I'm stuck, this fixed mindset that we see in narcissistic people.
Is it a victim?
The what?
Is it kind of a victim mindset?
A victim mindset can absolutely be part of it. Yes, a victim, perfect, superior, all of the narcissistic mentality can show up as a very superior, I'm better than the world, or the victim of nobody understands me, everybody hates me, I'm going to go eat some worms. Okay. And so we have both sides of that show up as narcissism. But if you have this growth mindset, then you start to recognize that, okay, not everybody's thinking about me all the time. And that person talking to me this way might have more to do with their background than it does with who I am. And so maybe I'm not as judgmental of their words because, hey, maybe there's something going on in their world that causes them to be reacting to me this way. And so it becomes where we're no longer just so focused on how people are treating us. That's a growth that takes you past that says, that's not a narcissistic person. While they might have had narcissistic traits, they are growing past that. That's that emotional growth that narcissistic people don't do.
Can they learn to do that?
So they can learn to mimic it. They can learn what they're supposed to say, what they're supposed to do. It can be a learned behavior. But if they do not get vulnerable. But if they do not get vulnerable and self-reflective, then they cannot actually grow past this. It will still be learned behavior. Okay. So it's like an alcoholic. If you've got an alcoholic who I can learn that I'm not supposed to touch that alcohol, so I'm not going to do it. I can learn that I'm not supposed to go to that bar, and so I can do it. I can learn what I'm supposed to do, but I don't go through the steps. Like you said, the 12 steps or whatever steps it is. It doesn't have to be that, but don't go through the steps of actually getting the help I need. I'm just learning what I'm supposed to do. Right. Now, how successful is that going to be?
Right. We call them a dry drunk. Yeah.
It's not they're not gonna ever actually change and get the help.
Right. Okay. Some of the people with cluster Bs that I've spoke with on the podcast, they've mentioned that their personality disorders are actually a defense mechanism, just like alcohol is.
Mm-hmm.
And it's caused either through pain or trauma or a learned behavior from another narcissistic parent or whatever. So in a way, do you feel that they are suffering as well? It's not just their...
Absolutely.
Yeah.
Absolutely. And I hate it for them. I do.
Mm-hmm.
And I really hope and pray that they could get the help that they need. Just like an alcoholic, the dry drunk, I would hate it for them. Like, this is their own coping mechanism is in the way of them getting the help. And that's how the narcissism shows up, is their own coping mechanism is in the way of their own ability to get help. Because to get help, you have to be vulnerable. And one of the pure signs of a narcissist is they cannot be vulnerable. Because they can't, because that means that they would be possibly under attack, and they already think that the world is out to get them. And so they can't drop that defense.
That sounds frustrating.
Yes, extremely. And for those around them who love them and care about them and are trying to get them help, want to stand by their side, want to see the help. They're there to genuinely love them. And when, just like if you, do what do they call it when you gather around to try to talk to an alcoholic, an intervention? Okay. Just like if you're trying to have an intervention and the person won't listen, they won't hear it. That's frustrating, but until that person decides they really want the help, there's not anything that you can do. You can try, but you can't really help them unless they really want it.
Right. Yeah, and then you talk about covert narcissism. So what's the difference between covert narcissism and regular narcissism?
And regular narcissism, yes. So overt narcissism.
There you go.
Overt is the other one. Yes, grandiose. It's also called, and covert is also called vulnerable narcissism. The words are used interchangeably, although they're not necessarily exactly right. But for our purposes, overt narcissism is more in your face. This is, the whole world around them sees the narcissism too. It's, I'm great and wonderful. I'm going to dominate conversations. I'm the life of the party. Everybody wants to look at me. Everybody's jealous of my life and how great I am. And so this is very bold and in your face. It's also going to be, do what?
Trumpish.
Well, yeah, I'm gonna leave that one alone. But yes,
yeah, I try not to
I'm
talk
not gonna argue with you either. So, but yes, it's definitely very, very presentable in the world and very obvious. Okay.
Right. Okay.
So the covert side, however, is behind closed doors, and this person can present as really a great member of society. They can appear to be very giving. They can be, they're donating to the charities. They're giving of their time. They are the coaches of the Little League soccer teams. They don't present like a narcissistic person. Okay. But behind closed doors, in their inner world with the people around them, you're going to get the arrogance, the entitlement, the superiority, I'm better than everyone else, but it's going to come out as, well, why can't you, understand what I'm saying? Because, clearly I'm using real words here, and what's wrong with you? And so you get these very dismissive comments, very invalidating comments, very passive aggressive. Okay. But it's not seen by the world. It's only at home, and a massive victim mentality. Okay, as part of this covert world. So where a overt narcissist is the life of the party, the covert narcissist is the Eeyore of the world. Okay, everything you've ever done hurts me. I can't believe you would talk to me that way, that you would say it this way, that you would do that. And then when you try to come back to them and go, hey, I'm sorry that I said it that way, instead of giving you space for that, where they go, okay, let's grow together and let's learn together and all of that. Instead, what you get is, well, I'm used to it because you always do that. That's a very dismissive comment of a person trying to come and genuinely reconcile.
Right. Right.
And so that's the more covert piece of it.
And then as a loved one of that covert narcissist, I suppose it's incredibly difficult to find any empathy or from anyone else because no one else sees it except them.
Absolutely.
Wow.
It's very isolating. You live in a very isolated world and
Controlled.
very controlled. Yes, very manipulated. You're making your checklist of, oh, I'll never say it that way again. I'll never do it this way again. I'll never bring that topic up again. So you've got this never, never list going on. And by the time you're 20 years into this marriage, there's a Grand Canyon between you. There's no, because you've never reconciled anything. And so there's this massive void where there should be a connection. 20 years into a marriage, I mean, you said it yourself, you're 26 years into a marriage, and the growth that has happened, that has caused you guys to connect and like magnets, you've been able to bond. That doesn't happen when you're in a marriage with a covert narcissist. It's the opposite, like polar opposite ends of a magnet pushing each other away.
How often is it that two covert narcissists are in a relationship together? Or is it always, one's kind of like, has to be more passive and...
Yeah, I don't know an answer to that. I can imagine that would be a very, very difficult environment. But with a covert narcissist, they tend to gravitate towards people who are fixers.
Right.
And so they become like magnets to each other. And somebody who's got a fix-it mentality, not necessarily growth-oriented like what I'm talking about, can be, but somebody who's very, very interested in caring for other people's needs. And you've got a covert narcissist who's completely uninterested in caring about anybody's needs but their own. Those two tend to gravitate towards each other.
They become codependent of each other in a way.
It becomes an addictive relationship. That's where I talk about the addictiveness. The covert narcissist is addicted to all of the energy, the mental and emotional energy that this partner is pouring into them. The partner is addicted to the moments of gratitude, the moments of what we call it breadcrumbing, the moments of praise that they get, the moments of approval that they get from this person who is otherwise difficult. So it's like a therapy project is what it, people talk about is I feel like I became their therapist. Right, I get that, because that was how you were getting fed from the relationship, is when you got those moments of, they call it intermittent reinforcement. Okay, those moments of good behavior where you thought, okay, good, we're making progress. We're making, this is hope in our relationship. And you become addicted to that.
Sounds terrible.
I mean, it definitely can cause a lot of problems.
Both people are craving something that they didn't have, and they finding it in the other person, but all it's doing is just perpetuating and making things like no one's like you said, no one's growing and no one's getting better. They're just spinning their tires. And then having kids.
We talk about it like being on a hamster wheel. You're just spinning on a hamster wheel, or you're going through life and you're really in quicksand. Every move you make, you just sink a little deeper. But yes, it's really confusing for the kids. And the cognitive dissonance that gets formed is where the kids believe mom and dad love me, but they sure don't feel loved. They don't feel cared for. So their feelings and their thoughts don't line up. They don't match. Their thoughts and feelings are in battle with each other then, which really escalates then as they move into adulthood, where, let's go back to what we were talking about, where you're now moving from childhood into adulthood and you're trying to adult. You're trying to figure out life. You're trying to figure out, who am I? And look at your background, which is your thoughts and your feelings are in battle with each other. And now you're trying to move into adulthood. So you're going to see a whole lot of coping skills, coping mechanisms that develop there. And that's going to be your addictions. It's going to be, disassociation from life. It's going to be your suicidal ideation. All of these different things are going to start to show up there, because you're taking such a broken, that internal battle, and you're trying to move this into adulthood.
Mm-hmm. I have a friend. His mother's not diagnosed, but he definitely thinks his mother especially, is narcissistic, and he's an only child, and like no one else. It sounds like a lot of the family's pretty screwy, to be honest with you.
It's
And
usually like, yes, it's usually a tornado. It's like somebody dropped a tornado in the middle of the family unit and they all got spun.
yeah, because I think the grandmother also had some kind of issues, and he knows it. It's all comes from pain, but at the same time, it's like I don't know, the poor guy. Like they manipulate him, they make him promises, they do, and they are constantly breaking their promises, and just yeah, it's so bad. It might even be borderline personality disorder because there's a lot of guilt and shame the mom puts on you. Why don't you love me? Why don't you love, like there's this
Mhm.
separation anxiety kind of thing, and then now he has kids and she's trying to get alone time with the grandkid, and he's very worried about that, and so he's always trying to, oh man, it just sounds like, I
It's
don't know.
chaotic. Yeah,
I
it's
I I
chaotic for sure.
I know I went through my own stuff, but that's my own stuff. It's like my own stuff. I can deal with it.
Yeah.
I can't deal with what
I'd
other
love
people are
to come
doing.
back and revisit now the undiagnosed ADHD and
Sure.
talk me through that path of, how did you come to that conclusion or what brought all that about?
Uh, well, I mean, I was sober for about 6 years at this point. I was being proactive. I was trying to break patterns. I quit jobs every few years, and I was in a job working for friends, and I was starting to have suicidal ideation again, and just depressed and feeling unfulfilled and frustrated. And then I was at a family event, and all my cousins were like talking about their ADHD meds, and then TikTok and Instagram memes and videos start popping up, and I'm watching them about ADHD, and I'm like, well, I relate to this. So I went and got an assessment, and lo and behold, it's like, oh. And then the more I've learned about ADHD, because there's what's that called, where it's like when you get a job and you feel like you're faking it, you don't really deserve it. I,
Imposter syndrome.
yeah. Even with the ADHD diagnosis, like, do I really? I felt like I had imposter syndrome, and until I started researching it more, and then once I felt comfortable that okay, this is what I have, I could look back at my life, and yeah, and just all these aha moments now that
Mhm.
I didn't have then, that this is what it was. So all my life, it felt like now all my life, it feels like I was trying to treat symptoms and not the main cause,
Right.
So now I take ADHD meds. When I do see a therapist, it's usually, ADHD structured. And yeah, it's been life changing.
Wow.
And it's been more accepting. Like I used to think, what the hell's wrong with me? Why am I still like this? What the hell? It doesn't matter what I try, I'm still like this. And having the diagnosis, like, oh, I'm just like this.
So you've been able to be more accepting of yourself, which
Yeah,
allows you to drop some of the defensiveness.
exactly. Yeah,
Yeah.
and some of the negative talk and stuff in my head, and um, I mean, don't get me wrong, there's still struggles, and sometimes even trying to convince other people that I have ADHD, because some people don't even believe it's a thing. So, um, but I don't worry about them. I'm like, whatever. But
Good.
but yeah, when you're undiagnosed, I feel like some of the stuff I was doing was very much addicted like. It's like I need things just so that I would control my environment, which means sometimes I would try to manipulate and control people, um and I could see how undiagnosed ADHD could come off looking like narcissist.
Narcissism. Yeah. Well, I
Narcissism.
mean, when you're talking about, ADHD, we're not just talking about like being distracted a lot or being hyperactive. Like
Right.
it's more than that.
Much more.
And it's a, it's something that fundamentally affects your own self-regulation. So emotional regulation, impulse control, motivation, time management, all of this is, what people don't realize about ADHD is it's not just about hyperactivity. It might present that way, but it might not actually. And so when someone grows up with it that's undiagnosed, especially, if you don't have the support and understanding around you, which you wouldn't have because it wasn't recognized, okay, that the ADHD was there. It's very easy to then internalize this sense of something's wrong with me. I'm too much. I'm not enough. I've got to be better. All of these different things. And we all go through that. Nobody gets through childhood without that. Okay. Without some form of, I'm the problem here. I'm not good enough. We all have some of that internal dialogue. Okay. Yours was driven by this undiagnosed ADHD. But what happens is you start to develop survival strategies, like we all do. Okay. To manage that, those overwhelming feelings. All right. Those overwhelming thoughts. And those are what looks like the personality disorders. That's what shows up as the narcissistic traits. Okay. And this is where I say all of us go through this phase of adaptive narcissism where we're going to have some narcissistic traits that show up in response to these, I'm not good enough. I don't matter. Nobody cares. And so we all have this, these narcissistic traits that show up. But again, going back to, you were able to reflect on this. You were able to acknowledge that, hey, there's some similarities here. Am I living this? Am I doing that? I don't like these patterns. I want to stop these patterns. All of that allowed you to grow past that. The whole point about this adaptive narcissism is when somebody gets stuck there, they get stuck emotionally. They grow physically. You look like an adult, you do adult things. They grow mentally, you go to college, get a degree, or you go get a job, or you go get an apprenticeship, whatever. You're doing adult things, but you didn't grow emotionally. And that trap, or that getting stuck in that emotional, whatever age, whether it be somebody who's 13 or 18 or 25, you got stuck emotionally and can't grow past that. That's where we start seeing what the world is calling narcissism in the adult years. So you were able to grow past that. The emotional growth kicks back in, which is beautiful, because then those behaviors, they weren't coming from a place of manipulation and entitlement. They were coming from a place of stress, your internal stress. And so as that stress reduced, your coping skills reduced.
Exactly. Right. You're correct. You passed.
That's how
test.
I see it from the academic side of all the research I've done,
Right.
This.
Right. And I mean, that sounds extremely reasonable.
Yeah. So when you see someone with ADHD who does finally get an accurate diagnosis and accurate support, okay, It's got to be both. We get the diagnosis, and then you go, okay, I'm going to do the work here. You mentioned, ADHD meds and therapy. I like that it's both. You don't want it to be. Yeah, and you got to get your own strategies, and now your own. So what happens then is your coping mechanisms start to soften because you don't need them anymore in that same way.
The other thing is, I was raised by a parent who I can guarantee you is undiagnosed ADHD. So growing up around that environment, I don't know where I'm going with this.
That's okay.
I don't know. I lost my train of thought there, but yeah. So I guess I learned his behaviors too growing up, and I just thought it was a family thing or whatever. And so I was, had my own bad strategies. Yeah. Still not sure where I was going with this.
It can be learned and mimicked behavior. It could also be, that in your environment, if a child is growing up in an environment where they don't feel safe, okay, and I don't know your background, if there was emotional safety there, verbal safety and all of that, but if a child grows up in an environment where they don't feel safe and they become hypervigilant, always looking for that safety, always looking over their shoulder for who's out to get them, that can present as ADHD. And so a school might look at that and go, well, this kid has ADHD, when that's not really what's going on. What's going on is they're hypervigilant about their environment because they don't feel safe. You know, and so there's a lot of complication there.
I wish we could just take a blood test.
It's not quite that simple. Yeah.
Right? Yeah, that's the problem with brains.
Yes. Yes. And these different things show up at different points in life.
Right, right. Yeah, well, another thing too, like this is something I've just been kind of attacking a little bit in the last couple of years was I had some sexual trauma growing up. It was child on child. So I don't feel like I was preyed upon or as a victim of anything other than circumstance and being a kid, being in the wrong place at the wrong time or whatever. And so, I don't know if that affects things too. I mean, and I know there's no one answer for anything. I mean, we're complex things. And, yeah, so it's weird trying to decompartmentalize my life and situations and then be like, okay, that was my ADHD, that was my addiction, that was my trauma, and you can't really do it.
Well,
so
they're all interrelated.
Yeah. So trying to treat something that's like, it's like, I don't know, it's like a great big knot, and you're trying to figure out this knot.
Yeah. It's like a spider web, and if I pull on this side, that side moves, and so if I push on that side, this side moves. They're all interconnected.
Yeah.
A lot of it comes back to the fight or flight response, our primal brain, which is our fight or flight center. And if we're coming through life and we're experiencing threats, emotional, verbal, mental, physical, sexual, whatever, but we're experiencing threats, then our fight or flight center of our brain gets hyperactive. And so we feel like, we're always under threat, or we feel like we're always got to keep we got to have our guard up. Like I talked about earlier, I got to always have my guard up in life. And the other thing that does, though, is it doesn't allow the front part of your brain, the prefrontal cortex, to develop. You get stuck there. And that's your emotional regulator. That's your impulse control. That's your short-term memory. That's your, being able to focus and concentrate. All of that is up here in the front part of your brain. And so when you have this hyperactive primal brain, this part of your brain, the front part of your brain, actually kind of shrinks. It gets knocked offline repeatedly. So it learns to take backseat to the, survival brain. And that's, I with the ADHD diagnosis that then you got, what I would imagine, and maybe, talk me through this, but what I would imagine you find is that then the fight or flight mode can settle down and we get that to relax and my guard to relax some. Did that change your emotional regulator, your impulse control, your ability to focus and concentrate? Was that impacted then?
Yeah. Well, actually, getting sober helped with that even quite a bit, and then the depending on the emotion, I think, and situation, and then the diagnosis definitely helped as well, because I've since that diagnosis, I feel like I've been quite a bit more kinder to myself, because it was very validating, that there's nothing wrong with you. I don't know. Some people were like, why would a diagnosis even help? I don't know why you're even getting assessed. And it was like, they're just labels. And I get that argument, but also it was like, well, I needed that diagnosis to know that, okay, I actually have something, this is who I am, and this is what I needed to hear.
Right.
Yeah.
But you didn't take that diagnosis then and use it as an excuse. Well, this is just who I am, and I'm going to still keep treating people mean. What I'm hearing from you is it allowed you then to kind of relax and put your guard down so that you could grow.
Right. Yeah, 100%.
Yeah.
Not that I was
beautiful.
Not that I was mean before. I was more mean when I was drinking.
Fair. Fair.
I was meanest to myself, really. but that's been, it's been life changing. And I mean, I still get suicidal thoughts and I still struggle, and this winter's been tough and whatever, but it doesn't go to the extremes that it used to.
Good.
I'm able to catch it now. Like I said, I'm more self-aware and I can figure out, okay, what am I not doing that usually helps, or what's a new strategy I should try? Because sometimes strategies stop working after a while, or depending on the situation and stuff. So yeah, and I'm more willing to try strategies. I don't dig my heels in like
Good.
I used to.
Good.
Yeah.
Well,
Yeah.
and that speaks to where you talked about, is there a difference between, or the differences and similarities between ADHD and narcissism? And I hope that we've used this as an opportunity to voice that I mean, there are similarities in that they show up as these coping traits. Okay. And that's where the similarities are, is the coping traits can look the same.
Yeah.
But the differences that are there are, where narcissism is rooted in exploitation and control, wanting to exploit the other person and make myself bigger and make them smaller. That's where the narcissism shows up. But the ADHD, these were survival traits. They were rooted in protection. They were rooted in adaptation. And while they might have looked similar, once you got the diagnosis, it allowed you to realize, the core motivation that was going on here, and then you can grow past that.
100%. And like you said, like, I didn't just use it as an excuse. So I feel like it doesn't matter what you're ever diagnosed with, or if you have trauma or PTSD or whatever, it's not fair. It's not it's not fair that you may have these things. Mental illness or whatever may not be your fault, but it is now your responsibility. And if you don't do the work, like you said, you can be diagnosed narcissistic. You can mask that you are doing the treatment, but until you actually do the work, I mean, you're just spinning your tires still.
You are, and you're still spinning your tires and slinging the mud all over your relationships of the people closest to you. Yeah, if you don't do the work. So yeah, the difference, the key huge difference there is, it's not an excuse. These labels are not there to be used as an excuse to then justify bad behavior. No, it's to gain understanding so that then you can know, the direction of work that you need to do. Whereas the direction of work that I need to do is going to be different. Okay. My work is going to need to be in a different direction. That doesn't mean I don't have work to do. We all do. I have growth that I have to deal with. I'm going to have to handle my codependent tendencies, my, fix it mode mindset. All of these things are things that I need to work on. But as soon as I can identify it, then I can work on it. And I think that's what you're saying with the ADHD. Once it got identified, then it's like then your growth could happen.
Right. And I mean, I'm not saying you can just cure ADHD.
Growth, not cure,
yeah.
growth.
right.
Yeah.
And like there are some things that I just can't do or can't do like the average person does. So then I do know my limits. I know my boundaries, but I can adjust my life appropriately around it. So, okay, maybe this type of work isn't suited for me. Maybe I can't work a full-time job. Maybe it's 2 part-time jobs because I get bored doing one job. But yeah, I just know, the more I learn about myself, the more I know how to live easier, I guess. And which then everyone around me lives a little easier.
It does translate out that way. Yes. When I start learning to talk nice to myself on the inside, it translates out to I'm talking nice to the people around me and closest to me. And when I'm talking mean to myself on the inside, it translates out that I'm talking mean to the people closest to me. There is a correlation there.
Yeah. It's like that. No, that doesn't. I was going to talk about something that doesn't.
No worries.
Not right.
No worries. No. But Todd, thank you for your time here and for sharing this. I think this conversation has been really, really valuable.
Oh, good. I'm the opposite of narcissistic. I'm like, I don't think anyone's going to like my conversation.
I mean,
Well,
we
that's
just
good.
never know, but I want to put stuff out there that's going to help people.
Yeah, 100%.
Yeah.
Yeah, that's why I got into this too. It's like, I don't want you to have to go through the crap I did.
Absolutely.
Or if you
Absolutely.
do go through the crap I did, at least you're slightly been warned.
Yeah. Go through it with a little more support and information available, at least.
Right.
You know, I don't know. With me, I know when I started facing what was going on in my marriage, covert narcissism wasn't really talked about. Like, it wasn't what it is today, the pop word that's available today. When you were going through getting this diagnosis of ADHD, how long ago was that? Where were we on that?
Oh, that was about 3 years ago. So it was trending.
It was.
And I was worried. That's kind of part of the imposter syndrome. I was like, okay, is this just a fad right now? So I didn't just go to a family doctor and ask for meds. Like I was like, if I'm going to get a diagnosis, I want like a full-fledged assessment. So I went through a long process assessment, and because I wanted to make sure,
Right.
you know?
Right.
Yeah.
Okay.
So yeah, I'm quite confident with the
Good.
diagnosis, and yeah.
Good.
And,
Well,
yeah.
I'm glad. So,
Be sure to subscribe and to like this video. You can listen on Apple Podcast and Spotify. This is Todd Rennebaum saying, make your beds and take your meds. Keep watching for more interviews with incredible people telling their stories of resilience and adversity with mental health and mental illness.